Hello, everyone. Thank you for being here. And thank you to the Casa de Sante for having me. This is a great opportunity to interact with the audience. Okay, so I'm Dr. Cecilia Minano. I am a gastroenterologist here in New Jersey. A little bit about myself: I've been in practice for over 15 years. I came to sort of this realm of chronic stress through my own burnout story. So I'll just share a little bit about it. But my background is I came from a single family home, a lot of chronic trauma and stress, no one's fault, just the nature of the circumstances. And I recall very much like suppressing emotions and feelings. And I was lucky that I had a love for education from a young age. So it's through this journey that I learned to sort of self sacrifice, give so much to others, people please, and I pushed myself beyond any limits, which on one hand was very exciting for me because I was able to achieve my dream of becoming a doctor. And I will say, as I look back on that experience, I don't ever want to change it, but there was definitely things that could have been improved. Anyone who's had chronic stress or trauma, we never wish that upon ourselves, but we sort of look at the other end of what did we learn from it. So fast forward, I was at the pinnacle of my career, working hard. I have an amazing family, and I still was very unhappy. And I didn't realize at the time, but I was in what we call burnout, which is where you have a lot of stressors on your body, physiological, emotional, mental, and you're just not showing up in the way you want. And what happened was that COVID hit, and seemingly I believed I had so much control. I worked so hard. I had this family. I had a robust, private practice. And what I realized during COVID is that my anxiety that had sort of been under the radar had sort of erupted. I was showing up very frustrated with myself, with everyone, including my own family members. I was not sleeping. There was times of very emotional distress and even crying. And it was because I was dealing with this COVID that was sort of outside of me, and I felt like I had no control over it. I even had patients who passed from COVID and colleagues, and I just had been never someone that really addressed emotions. I'd always been like, just keep going, and it reached a head where I couldn't. And I was thankful in that moment of crisis for myself that I remembered I had met a surgeon at a retreat like a few years back, and she told me about the world of coaching and how much it had changed her life. So in that moment, I called her and I said, "Hey, I don't know anything about this, but please tell me all about it." And that's when I began my journey of coaching, which is this journey where you work with someone. We sort of look at what your mindset is, habits, and how to really create the life that you want, that we all want on this journey. Um, and so, what I've realized now, having gone through my own journey of coaching, is that there's this big gap for like the population to really get these life skills under their belt. And what I love about what I'm doing now is I'm combining my medical knowledge as a gastroenterologist now, my own lived trauma and chronic stress history and burnout, with filling this gap for people who are now dealing with chronic gut issues. As we know, people who have these issues want to get better, and they're working hard at like working on their best diets, their best supplements, getting that self-care, but there's still like a big divide from what we know and actually putting it into habits and daily practices. And what I find with my work is that there is this underlying like chronic stress and trauma that is impacting people's overall health, but particularly in the gut. And so I see myself as sort of being a bridge between your provider, doctor, functional medicine nutritionist, and with me as a life coach to help you sort of deal with day-to-day management of these symptoms. And what I do with my work is I help people to reintegrate the mind and body that I myself had cut off for so many years. We learn to suppress emotions and sensations, but eventually that begins to speak to us. And if it's not like a little nudge we feel, eventually we're going to feel it in some other symptom. So I use practices of coaching work, somatic experiencing, where we go into these sensations and try to learn the meaning of it and not have any fear or anger with it, but more curiosity. I teach about pain reprocessing, which are a lot of people dealing with chronic pain issues, and how to change the patterns that our brain is believing about these pains. Um, I deal a lot with like embodiment practices. So, like yoga poses that sometimes help to empower us, to help us break free of certain like states, like if we're a freeze response, which we'll discuss. How do we open ourselves up to sort of get more empowerment? So those are sort of the things I do with clients. I do both individual and group coaching, and that's what I'm here to share a little bit more about with you guys. Next question. Okay, so someone had written in, I was recently told, excuse me, my light goes off. I was recently told I have colitis of the ascending and hepatic flexure. What does this mean? I was put in 5 days of antibiotics. I still have sand-like diarrhea. I follow a strict brat diet. I also have frequent nausea. So again, I'm here as a general doctor. I'm not your doctor, so obviously heed the advice of your own doctor that's actually examined you and done testing. But what I will say is that colitis is inflammation of our large intestine, the colon. And it looks like what you're describing is you have a, inflammation potentially of this sort of right side of the colon. When we see that inflammation, it's either seen on like a CAT scan, for example, or clinically you're having symptoms of like diarrhea, even fever. So there's different causes of it. There's the infectious causes, which we do stool testing to check for. Inflammatory is when you could be getting something called inflammatory bowel disease, which is not where it's just an infection, but more of a chronic issue. And sometimes we have to do a colonoscopy to determine that and look what it looks like and get biopsies. And then there's something called ischemic colitis, which is like a low blood flow state to that part of the colon. The good news about that latter condition is when we get the blood flow back, which is very common, you get no sort of residual effects. So I'm not sure what you have, but I will say that antibiotics are not uncommon to treat it with. And we can see people have lingering effects, both from the antibiotics as well as from that infectious or inflammatory process for weeks or even months. So the fact that you still have, some loose stools and some nausea is not surprising to me, because we do see effects, like I said, from the condition, from the antibiotics, and it does change sort of the flora of our intestinal tract. So I would definitely, if it's continuing, follow up with your doctor to make sure that, it's still within a normal time frame, or if you need additional testing. Next question, please. So how are our hormones tied to our gut health? So I love this question because we don't realize the impact our nutritional state, takes on for our overall gut health. So we need, from a daily perspective, a lot of micro and macronutrients. Micronutrients are your vitamins and minerals. So zinc, selenium, the B complex, iron, folate, those kinds of, necessary nutrients. And on the macronutrient level, we need a mix of carbohydrates, fats, and protein. And we need these to sort of create hormones, but also to allow us to absorb them. When we're diet, we're not able to adequately allow for these hormones to be produced and also uptaken. We know, for example, for people that have a poor microbiome, that we're, like, for example, eating a lot of sugars, right? You're dysregulating your glucose and insulin. And there is a bacteria called Lactobacillus reuteri, which is very much involved with insulin regulation. So we could be disrupting it into the bad microbiomes and less of that one. The other thing is estrogen is a hormone that we all know about. It's detoxified in our liver, and a majority of it is actually supposed to be let go in our gut. And what happens when we have a poor diet is that more of that estrogen is taken up, and it can lead to estrogen dominant conditions such as PCOS, polycystic ovarian syndrome, endometriosis, and even potentially cancer. We also know that thyroid hormone it becomes active in our digestive tract up to 20%. So if we don't have a good, digestive tract, it's affecting its ability to produce thyroid, and that can lead to conditions of fatigue, low energy, hair loss, or on the other extreme, more hyperactivity, not being able to sleep well. So I would say from a sort of basic level, we have to get all our nutrients, vitamins, and the best place to do that is through our diet. Otherwise, we sort of supplement with, pills or supplements that you can buy online. But it's important to really hone in on that we have to learn to incorporate foods, even though if they're not the best tasting, because they're helping our overall system. Okay, next question. I had a Nissen fundoplication 14 months ago. Since then, have sulfur burps. Antibiotics worked while taking them, but came back weeks later. They come and go as they want. How do I get rid of them? Water seems to make them worse. So the Nissen fundoplication, for those that don't know, that's when you have severe acid reflux, and the thought is that a hiatal hernia, a little bit of your stomach is popping above your diaphragm, and that's creating that condition. So what surgery does is it wraps around the part of your stomach around that area to bring down that stomach area and to prevent acid from coming up. Sulfur burp, is very sort of non-specific, but I'm thinking of causes that your doctor may have done. We check for like H. pylori. We sometimes acid reflux can sort of create these sort of different sensations of burping. A lot of caffeine or dairy or milk, certain foods like vegetables, particularly our cruciferous vegetables, which are good for us, like broccolis, cauliflowers, can also contribute. The fact that you got better with antibiotics, sometimes we worry about like something called small intestinal bacterial overgrowth, where there's an abundance of bad bacteria in our small intestine, which is then detected by a breath test. And sometimes we give antibiotics to sort of suppress those bad bacteria so that our good bacteria can overpopulate. Water is generally supposed to help make us feel better because you're flushing out toxins. So I wouldn't necessarily recommend stopping that. Maybe more of a function of, what you're eating and not necessarily the water. Or conversely, we are seeing cases of motility dysfunction, particularly after COVID or any viruses. It is affecting how your stomach sort of contracts, and I'm thinking sometimes sulfur burps are from food sort of sitting in there. So sometimes we do recommend eating more of small, frequent meals, because then your stomach's sort of able to break that stuff down a little easier. But I would definitely, again, like I said before, follow up with your own doctor to get specific advice for your case. Okay, next question. Can you explain how chronic stress impacts the nervous system and contributes to negative health outcomes? Yeah, so I love this question because a lot of us don't even realize how much chronic stress is impacting our overall health. So what I'll share with you is that many of you may not be aware, but we have what's termed the polyvagal theory. The idea is that our vagus nerve, cranial nerve 10, which goes from the back of our brainstem down to our body, is very much in association with what's happening in our environment and what's happening internally. And a lot of us may not realize that we're in a chronically stressed state. And so our vagus nerve is then sending a lot of fear signals and release of like stress hormones like cortisol, neurotransmitters such as epinephrine, norepinephrine, and that's creating a lot of signaling pathways in our system, and it's very much affecting our health outcomes and especially our gut health. So if you can imagine, when you're in a stress state, you're releasing a lot of like these stress hormones, which are working to keep you alive, which is why they were made. But then on a gut perspective, it's sending a lot of inhibitory messages to your gut. So that's not allowing for that natural motility, contractions. It's not allowing for that absorption of vitamins and minerals and nutrients like we discussed. It's not allowing for secretion into our digestive tract, which helps to remove toxins and also helps with elimination. So what I want to offer with this polyvagal theory is that Dr. Stephen Porges created 3 sort of states of this vagus nerve. So the one we want to be in, which a lot of us are not, is that ventral parasympathetic system. And what's happening with that is our vagus nerve is online. We're very much engaged with the current situation. We're releasing a lot of calming hormones to our digestive tract, which is allowing it to optimally function. And we always want to strive to be in this state, particularly when we're about to eat. We want to engage that vagus nerve to allow our digestive system to work optimally. The other state I like to talk about, which we all know, is the fight or flight or sympathetic response. And that's where we're releasing a lot of stress hormones like cortisol, that epinephrine and norepinephrine, where our body's perceiving or we're in an actual fight or flight state. And so it's shunting blood from that digestive tract into your, heart, lungs, muscles to try to get you away. But it's affecting you systematically, like I discussed. The next state to be aware of is that freeze response, or the dorsal vagal response. That's when your nervous system has become so overwhelmed that it can't even comprehend or understand what's going on. And so your body works to put yourself in a survival state. So you sort of shunt blood again into more of a collapse state. And it's also very inhibitory for your gut. So what we don't realize, particularly us like high achieving professionals, is that we're living in this chronically stressed state. We've reached such pinnacles of success through our careers. And so we're go, 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 go. But what happens from our body perspective is that eventually our body is like, whoa, whoa, slow, slow, slow. And we get different messaging in our body. And for some of us, it's like our gut symptoms. And others, it's like our sugar's dysregulated. And others, it's not being able to sleep, chest discomfort, neurologic or mood disorders, right? So I think this is a time in our state where we have to sort of learn to pause and bring back that vagus nerve, because we know that it has long-term side effects. Okay, next question. How do you work with clients to identify patterns of chronic stress and develop strategies to manage and reduce it? So I love to highlight to, my clients that, it's not their fault they're dealing with chronic stress. It's unfortunately the state of affairs we're in. We've reached a point where like go, 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 our social media is always on, our kids are, having after effects from social media, sugar. I mean, it's constantly on. For some of us, we're, as soon as we wake up, we're like looking at our phones, the news is on. So we never learn to sort of decompress or bring again that vagus nerve back online. So the first thing I like to help my clients to do is to recognize of those three states we discussed. Do you primarily live in that parasympathetic state, or are you chronically in that sympathetic overdrive or in that freeze response? And again, it's no judgment, but I like to just take an assessment of their day-to-day experience. And I love to highlight for many of us, including me for many years, waking up with the to-do list and running ahead and planning and dreading and all the things. But what we don't realize is we're inadvertently sending a lot of negative messages to our body, and that's just not healthy. So it's like we haven't even gotten into that stressful situation, but we're already like waiting for that shoe to drop. So that's the first thing. And then I help my clients to begin to recognize, okay, which area do you want to work in? And then we work on how to reduce it. So I'll give you a couple of examples of clients I've helped. So one is a woman whose husband had unfortunately passed during COVID, and she then secondarily got another infection of her gut. And so when I met her, any sensation she sort of experienced put her into a either sympathetic overdrive or freeze response. And so we worked together on learning that she was resourceful and that she would be able to get help when she needed it, but that alarm system that had been sort of second nature to her, we learned to quiet it down. So I forgot to mention this part, but we have this part of our brain called the amygdala, which is constantly scanning in our life for danger or safety. And for those of us that have had trauma, in this particular case, this woman with her own health conditions, but also her husband who had passed away, she immediately would go into this panic state. And so our work was really pausing and recognizing, okay, I'm in a state of stress. Let me look around my environment. Is there like a lion coming to get me? And am I in a fire? Is this warranting this level of stress? And what we found is that oftentimes it wasn't. It was just patterns that she had developed over time. And so we recognize, okay, we're safe. Let me do some exercises now to ground myself, to remind myself I'm safe, I'm resourceful. And so we retrained her brain to create a new relationship with these sensations. And what I love about her story is that she still experiences sensations in her body, but it's not putting her immediately into that panic state. She's recognizing where she's going, and then she's just looking around, reminding herself, no, I'm safe. And then she's taking deep breaths, she's grounding, like stepping into the floor to really create safety for her nervous system. And so she now functions where it's not like the end of the world for her when she feels these sensations. Another client I helped was a gentleman who worked in like the finance sector and constantly gave so much of himself. And he came to me because he was showing up with poor diet, not sleeping well. And what we learned with him is he never developed self-care. He was constantly giving to work or his family. And so he never really learned to bring that vagus nerve online and to decompress. So we started with little baby steps. And like every morning before rushing to get to his phone, it was like, I'm going to meditate for 5 to 10 minutes. So it was like a pause, sometimes guided, sometimes just focusing on the breath, reminding his nervous system he was safe. And we started with simple 5 to 10 minutes a few times a week. And then over time, we built that up. And as he realized his nervous system was better, he was showing up better. He was making better choices. Now, when he got home, he did it like in the car before coming in. He was now in a more parasympathetic response. So then when he came home, he wasn't like overindulging in eating or binging on sweets or alcohol that had normally been used to sort of calm his nervous system. Now he was having more resiliency within himself to use these skills to help himself. And overall, he's living a better life. He's engaged more with his family. He's meditating a few times a week, doing exercises, and he's lost some weight. I mean, it's like amazing how much this can transform you. Okay, next question, please. Can you describe some of the techniques you use to help clients regulate their nervous system and process difficult emotions? So I touched upon this a little bit. So I'll explain a little more detail. So when our nervous system is overwhelmed or chronically stressed, like remember, it's that amygdala that's perceiving what's happening and telling us we're safe, we're in danger. I try to teach my clients that amygdala is like our inner child, and so we have to learn to nurture it. It's not our nature to reassure it because we've been living chronically stressed, putting out fires, always giving of ourselves to others. And so when we think about that amygdala, that's sort of how we bring in these techniques. So one thing, like I said, in the morning is being very mindful, practicing those breathing exercises before going to your phone. I love to have people, as they brush their teeth, really feel the sensations of the bristles of the water in their mouth. It's really being mindfully present. Same thing when you're in the shower, right? As you rub your shampoo, like let go of the story of like all the things to do. I have to take care of this. I have this meeting, and really just honoring that amygdala and creating safety and reminding yourself you're safe, you're resilient, you're going to get through this. And so that's some of the techniques I use to purposefully, again, bring that parasympathetic nervous system into place. And the same thing with processing difficult emotions. So emotions are really hard to manage when you've never really addressed them, right? I'm a survivor of this, right? I learned to suppress emotions for 4 decades of my life. And it was good for many years. I was like a great worker. I gave of myself to everyone. And then finally, like I said, COVID hit, and it just had no more room. So what I help my clients, particularly who find this as a problem, right? Some people have difficult emotions and want nothing to do with them. But for those of us that do want to get better, whether that's with our family or loved ones, or making better decisions, or just being less burnt out at work, etc., what I tell people is all emotions are good. We're all human. Life is never supposed to be 100% happy, even though we're sold that in like social media and TV. We are supposed to undergo hardships, but it's how do we become flexible or resilient in these difficult moments. And so part of that is facing that emotion. It's like when I have a bad day, it's like accepting, all right, today was really difficult. I was really frustrated. I'm going to sit with this feeling. I love to help clients sort of describe what they're feeling, because sometimes we get so much knowledge from knowing, okay, I'm frustrated now. For me, that shows up with my ears feeling hot, my face is flushed. And so when you have awareness, you can say, okay, I'm going to honor this time for 10 or 15 minutes, whatever it takes. But I recognize that that's just a pattern and a feeling I'm in, and it doesn't have to define the rest of me. So then you allow it, you give it its moment in space, you breathe through it, and then you find that feeling that felt so powerful is now sort of dissipated. And then you can decide, okay, I was frustrated, I acknowledged it, I let it go. How do I want to show up? So it doesn't have to be, some extravagant thing where now I feel joy after a frustrated day. It can be as simple as like, I just want to feel calm. And it's like, okay, what do I have to believe to feel calm? I have to believe that I did the best I could today, and that's good enough, right? When we can believe thoughts that serve how we want to show up in the world, that then creates all the ways we act in the world, and we believe, and it prevents us from doing things we don't want out of like negative emotion. So I used to be somebody that would have chocolate when I was having a bad day because I believed that I deserved it, that I wanted to suppress these emotions. But now I just honor my day, and then I lose that urge that used to calm me. Now it's like, no, I have the power within me to calm my nervous system and to decide ahead of time what I'm going to choose to eat to nourish my body. Okay, next question. How do you tailor your approach to meet the specific needs of each client? So I love to meet with people to see, where they're at, what are the goals they want to achieve. So for some people, it's like they want to achieve weight loss. Some people want to achieve like more connection with loved ones. Some people just want to show up less frustrated at work, right? So what I tell them is, how do you envision your future? What would it look like? And then we go back and say, okay, where are you at now? And we sort of try to meet that gap. I don't like to have too many new habits or patterns form, because we don't want to create a scenario where we're not successful. So if somebody wanted to begin to exercise, for example, it's like we would start with like, all right, how can it look for you to do like 5 to 10 minutes? For somebody, it might be, all right, when I watch the news, I'm going to do like 5 to 10 minutes of jumping jacks. So it's like you're starting the process. It can be like, oh, I have to walk my dog, so let me engage in that and maybe do another block, right? We just want to create a minimum baseline where we're successful, but we're still moving toward that. And then what we find is success builds upon success. So if we've now done 10 minutes, is there a way we can now do 15 or 30? Or on the weekends, can we incorporate a little bit longer? So part of that is planning that habit ahead of time. And then part of it is also learning to create boundaries, for example, right? So especially as us mothers, we're constantly giving to others and housework and etc. And so sometimes like we have the intention to exercise, but then, the dishes are there, the laundry's there. So it's like learning to create a boundary with ourselves that we don't have to rush to do this thing because this thing is just as important. And so I'm going to say no for now to this so that I can keep committed to this other part of me that is also very important. So that's one example. Another one is people who can't sleep. Okay, so how do we ensure you get X number of hours, for example, if you want 7 hours? So what do we have to create within your day-to-day to build you up for success? So maybe it's like I have to turn off my tablet an hour before. I have to, put my meditation on. I have to read this. I have to journal this. I have to write all my worries down so they're out of my head. So it really is a sort of individual basis, but it's again honoring yourself and reflecting on it into you. Okay, next question. What are some common misconceptions about stress and the nervous system that you encounter in your work? I think for a lot of us, particularly high achievers or people pleasers, we believe so much from like societal norms that we have to give of ourselves to others. But what we don't realize is we're living in a chronically stressed state. We're never bringing in that vagus nerve to allow our nervous system to decompress. And what we know from literature is that chronic stress and trauma have negative implications on our overall health. So I didn't mention this before, but there was a landmark study called the ACE study, which looked at 70,000 individuals and experiences with adverse childhood events. So it was 5 personal and 5 related to a close family member. And what they found is that there's a direct link from this sort of traumatic state to long-term health outcomes. So there's an increased risk of heart and liver disease, cancer, autoimmunity, diabetes, and even suicidality. So, and then what's even more fascinating is that 87% of people in this middle-aged cohort reported a score of at least 1. So it's very common in our system, in our society, for a lot of us to have had traumatic experiences. And so if that's not food for thought of like, oh my God, my risk is so high to be living in this chronically stressed state, to be leading to these health outcomes, what can I do in this moment to change? And again, like I said, it's simple habits that we sort of stack upon themselves. So letting go of the beliefs of like, I have to take care of everyone else. Well, guess what? If you don't take care of you, like some of all the rest of this may fall apart. So how do we carve in like 5 minutes, an hour here or there so that your nervous system can regulate? Because it's from there that then you can show up as your best self for your families, for your loved ones, for your own health care. So I think for us, it requires, especially as high achievers that are like, go, go, go. It's like learning to pause, to bring that awareness in, to recognize what state am I in? Where do I want to be? Learning to adopt things that decrease stress. So we know from numerous studies that, play, being creative, being outside, moving, breathing, connecting with others, laughing and crying are ways to discharge stress, the energies of stress that can get embedded in our bodies. One other thing about the stress of work, it's like, I feel like we're all drowning in it, where you live in it, and it's learning to create boundaries where you still are fulfilled professionally, but that is also self-care for you. Yes, you could take on another project, but what are you not taking on that you need for your own well-being? Right? We're used to saying yes, 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 but sometimes it's like, let me pause and reflect. Does this really serve me right now? And reminding yourself of like, what do I want, not what I'm being told. So it's a lot of introspection that is sometimes best guided by a coach. Okay, next question, please. How do you incorporate mindfulness and other mind body techniques into your work with clients? Um, so I so mindfulness is this idea of being present with your current state, with all the experiences, all the sensations, all the feelings that are coming forth, and just sort of allowing it. Um, so I'll give my own example because like I said, I lived in this chronically stressed, traumatic state for a long time. Sorry about that. It's electric efficient. So what I do, for example, is I I was chronically the person that got up and checked the email and the phone and the consults that were coming in. And now I very much go, if they needed to reach me, they would have reached me. I do 5 to 10 minutes of meditation, or I do 5 to 10 minutes of stretching. And then when I'm in the shower, just being present there, I notice my brain is like, oh, you have to call this person, and oh, you have to schedule this. And I constantly just redirect my brain to like, no, I'm going to really be present with this water on my face. I'm grateful for the day. I'm grateful to my higher power. I'm stepping into putting my feet into the tile, really grounding exercises, again, creating safety for my amygdala. Um, I want people to honor that amygdala and almost like that little scared child. How do we bring it back online with nurturing, compassion, and love? Um, Other mind body techniques, I try to have clients before they eat really bring in that vagus nerve. So let me practice taking 2 full deep breaths before I eat and being really mindful with the food, right? So I'm going to honor it and be grateful to the farmers, to the grocery people who put it out there, to the person who prepared this, honoring them. I'm going to really be into the sensation. So I'm really going to smell it, taste it, feel it, whoosh around my mouth as I chew it. Again, being very mindful during the moment. And that's really creating that safety, that ability for the food to be broken down, to be absorbed into our body, to help release toxins. So those are simple things. I do the same thing at night. I try to do a 5 minute mindfulness practice. I try to journal a few times a week because sometimes we don't realize, but the thoughts we have are just patterns that are well rehearsed. And sometimes it requires them to come out of us for us to recognize, is this thought really serving me? Is this true? And that's where a coach is amazing at helping you uncover. But if not, even simple journaling, you can say, oh, I really believe that. I wonder why. And then you really begin to explore with yourself. Okay, next question. What are some of the most effective life skills you have seen clients develop to cope with chronic stress? So I think I like to honor the nervous system states, because I do think having awareness of where your nervous system lies, when you have that awareness, you can decide to change it. So I love to have clients do like a recognition in a day, like where does my nervous system lie? From the moment I wake up, am I immediately in that fight or flight state? Or am I in that parasympathetic, I'm going to be present moment? So I think having that. I think another one is really honoring the feelings you're experiencing. So for me, when I would be frustrated or when I get frustrated at work, it's like honoring, like, of course I believe that. Of course this should not have happened. It's just acknowledging that these feelings are normal, but then regulating your nervous system so that you can then still decide how you want to react to them. We don't have to stay stuck in that frustrated state when we know that it's just patterns of our nervous system and that we have power to change. And then the other one I would say is adopting some sort of self-care routine for ourselves. So for some of us, it's as simple as like petting our dog, calling a girlfriend, connecting with friends, journaling, reading a book. But let's find something that is a life skill that's regulating your nervous system that you're more likely to adopt. And it can start at like twice a week. It's not something that you have to do every day. And you'll find that the more you can regulate your nervous system, then you begin to incorporate more new habits, right? And I also love to teach people that you try different things and we're flexible, right? If meditating doesn't work for you, right? Maybe it's for journaling for you. Or maybe it's like walking your dog. Like there, with all of this journey with any kind of health, care, self-care, like it's very into each person. So it's just like this restaurant or a supplement your friend recommends. Like you may like it or you may not. It doesn't take away their experience of it. It's just yours might be a little different. Okay, next question. How can someone with gut issues and burnout achieve work-life integration and personal and professional fulfillment? So again, so let me talk about the work-life integration first of all. So with this, I again tailor it to the individual. So when I was in the burnout, I never adopted any self-care. I never like prioritized myself. I never exercised. I mean, you name it, I didn't do it. I was constantly giving to my patients, to the hospital, to my family. And what I didn't realize is then I was showing up as frustrated, not realizing it's because my nervous system never had a chance to sort of get into a calm parasympathetic state. And so I share that because work-life integration is very individual. Some people want to scale back from like 80 hours to 60 hours. Some people want to scale down to 20 hours. It's very individual depending on your own personal and professional goals. And for some people, it's like they don't mind those long hours, but they want to incorporate more of the self-care or let go of those negative thought pattern. So I work on like finding people's why and where they want to be, and then we backtrack and say, okay, how can we incorporate this into what is your current state? And it's a great exercise to do, is to reflect on where you want to be and where you're at, because oftentimes where you want to be is not aligned with what you are. Like I remember wanting to be with my family, but if you looked at my hours, it was like 80 hours at work. So it's like, how was I expecting to then incorporate my family? So it's like you got to give and take. And I still do that to this day. There's certain weeks that are very busy for me, and my family recognizes that, yeah, I can't make that game. But then next week there is some time, so I'm going to make it a priority. So it's this constant work-life integration, but when you do it on purpose and you decide ahead of time, you let go of all the drama of like, well, I should be there, because you're telling yourself something that's just not realistic for you. And it's creating a lot of negative emotion. Whereas if you go, okay, no, I plan to be there next week, then like the story of like you should or you could have and you didn't, it's just like dissipates. Um, so, and then, so that's with burnout. With gut issues, we also know that it's personal and professional, right? What part of the gut do you want to work on, right? Do you want to work on the weight loss? Do you want to work on eating better? Do you want to work on, improving your overall like metabolism? Again, it's very individual, but we sort of chomp it down in small bites because we can't make like too many changes or we're not going to be successful, nor can we gauge did that really work for us. It's like in medicine, it's like try this, we give it some time to see if it sits with your body. Sometimes it doesn't, so we try different things. So it's the same sort of scenario. But I do want to tell people that you can achieve fulfillment. It just looks differently for everybody, whether it's your medical issues or your work issues. There's a way to honor that, but it's just like tapping into your own wisdom through questioning, through journaling, through pivoting and new habit formation, new thought formation, etc. Okay, next question. Can you give some tips on how to manage stress and improve gut health? Yes. Many pearls, but I'll like try to synthesize it. So I think know that the chronically stressed rat race state we've all been in, and don't like judge yourself for it, but just acknowledge that there's been all these factors outside of you, that it's your lived experience and your own patterns of how you react to things. And again, like I mentioned, that ACE study, some of these were traumatic things to your nervous system. So it's not a surprise that you react, frustrated or angry at times. Nobody ever taught us these life skills growing up, right? Our families were in a survival mode, so they didn't have time to pause or regulate, or they didn't have this knowledge base that I'm starting now to uncover for my own self. So it's recognizing that being in that state is not serving your overall gut health, your overall health in general. So, what are some things that you can adopt for you that help you to manage stress? So, simple things I like to teach my clients is, when you're waking up and you immediately go into that fight or flight, like let it go. Be 5 minutes, just present with yourself, breathe, remind yourself you're safe, that you're worthy, that you're grateful for being there. These are all ways to give assurance to that vagus nerve. And then another thing is, again, like I mentioned, mindfulness with your eating, right? If you have that 30 minutes, don't engage with social media. Unless you're going to call a family member that's going to calm you, really just try to focus and be present with that food. Engage those senses. Be very grateful with it. Same thing when you're gonna like have a bowel movement, and we haven't talked about that. But a lot of us, it's like we want to be done and you could move on with life. But for our nervous system, sometimes it takes that like extra step of like reassurance, getting into a state, really honoring those sensations, and like, no, I'm gonna give it the time it needs. Another way is honoring sleep patterns. We know that sleep pattern is critical for our overall health, particularly our gut. We know that a lot of neurotransmitters are made in our intestines, in the microbiome, like serotonin and dopamine are predominantly made there. And if we're living in a chronically stressed state, we're not allowing those microbiomes to produce these feel good hormones. And so we have to honor that part of us to really allow for that system to work well. We also have to learn to eat more optimally, right? So for a lot of us, we've been living in the sugar, processed food, alcohol sort of range, and it didn't affect us in our 20s or 30s. But guess what? Now in our 40s and later, it is affecting us. Some of us, it's affecting us sooner. It's like reminding yourself of your why, because that's sort of how you develop these new habits, right? None of this can sort of change overnight. It's a journey. So you start with what are priorities. If it's moving or exercise or sleep, pick one. And then how can I incorporate a little more? And we know that habits build upon habits. So start baby steps and then achieve it and then add more to it. Um, the other thing I was going to say with like the stress energy and ways to, discharge it, because it does get embedded in our tissues, is like creating more time to breathe, right? The breath I love because you can do it anywhere. So if you get really stressed going to work, like practice the breathing on your drive to work, right before you get out of your car, really engage your vagus nerve. Same thing on your drive home, right before you enter your house, and like let the work day go, like take some deep breaths. Walking, right? Connect with your pet or call a girlfriend or a friend, mom, somebody that's going to help regulate your nervous system, right? As you move, you're also connecting. Find an outlet of joy, right? For some of us, that creative part has been lost. It's like, do I do like an acting class? Do I just dance in my bathroom? It's like these are all things that create safety, bring that vagus nerve back online, bring joy into our life. So those are just some of the examples of how to manage stress. And it looks different for everyone, right? Like I said, some people don't like to dance. They'd rather just walk. Again, see what serves your nervous system and then pivot if you need to. But remind yourself that this is as critical as taking a pill, a vitamin, a certain diet. It's like regulating that nervous system is so, so important. And I think they said that was the last question. So again, I'm Dr. Cecilia Minano. I work in my day job as a gastroenterologist, but my evenings and weekends are this life coaching, where again, I learn to help people integrate the mind and body. It's so important. And for many of us, we've cut off our emotions, and it's showing up in different ways with like weight gain, sugar out of control, chronic medical conditions such as like autoimmunity, diabetes, heart disease. And so it's like, how do I reintegrate it? How do I change the perspective I'm telling myself? When you believe your body's broken, that you're never going to get better, guess what the lens of your world is? It's like you can't figure out how to get better. But if you can believe like, hey, I'm on a journey of healing, I'm going to figure things out, you're again creating more safety for that amygdala, which is then going to allow you to make better choices. So it's not a simple one fix all, but it's necessary and important. I hope you will take some pearls from today and learn to adopt them. And I would love for you to reach out to me. I'm on Instagram and Facebook at the CeciliaMinanoMD.com. You can also go to my website and learn more about my programming, set up a free consultation call where I can discuss your specific issues and see if we're a good fit. I thank the audience for being present. I thank Casa de Sante for including me in this talk. It's so great to connect with people that are working to help other people on their journeys of healing. So thank you.